There's been a record number of COVID deaths in Thailand, prompting authorities to impose strict restrictions as they try to stop the spread of more virulent variants of COVID-19. Joining us live from Bangkok is the Sky UK Southeast Asia correspondent, Siobhan Robbins. Appreciate your time. How is Thailand faring? What are the numbers you're seeing there?
We've just actually had another record day of daily cases. So today it's been announced there have been more than 4,800 new cases. And one of the reasons for that huge rise is because there's been a cluster linked to two prisons in Bangkok. So since the 1st of April, we've basically been experiencing a third wave here in Thailand, and it's been peaking with around 2,000 cases on average most days recently. Deaths, a record yesterday of 34. But as I said, today there's been this big surge because more than 2,800 new cases have been found linked to these two prisons, which is a big worry because, of course, prisons in Thailand are often very overcrowded. So a big concern about the spread there. But the restrictions in Thailand have been tightened up since this new wave began in April. So in Bangkok, for example, where I am, this is a high-risk area. So there are restrictions on things, for example, bars are closed, gyms are closed, malls are still open. People can still use public transport, but they are being advised to try and stay at home. And there are also restrictions about moving around the country. So if you are coming from a high-risk zone like Bangkok, many provinces are asking you to quarantine for 14 days when you arrive, unless you've had the vaccine, the 2 jabs of the vaccine. Now, the problem in Thailand is there hasn't been a very high level of vaccination yet. And the Prime Minister has said that he's going to push this huge vaccine surge, that we're going to see a massive uptick in numbers of people being jabbed from June. And they're looking to get 150 million doses of various vaccinations into the country. They have already started vaccinating some people, so high-risk people, people working in the tourism industry, and also people working in the health service as well. But still a very long way to go for Thailand as it continues to see this big rise in cases.
And Malaysia is struggling too, isn't it? I think it's just declared a national lockdown as well. The surge there really seems to be worrying authorities.
Yeah, and the lockdown that's been announced in Malaysia actually came as a surprise to many people. But they have, as you say, also been seeing surging cases, more than 3,000 a day, more than 1,700 deaths in total now. So the Prime Minister has announced a lockdown, essentially affecting most of the country, most people's movements, until the 7th of June. So people in Kuala Lumpur, for example, movement restricted there. People are allowed, though this time, businesses are allowed to stay open. They are still functioning. There was a very, very severe lockdown last year in Malaysia, which really affected the economy. So there is slightly less strict than it was then. But I think the big problem for many countries, particularly in Southeast Asia, is the fact that lots of them have very long land borders. So Malaysia has a land border with Thailand, for example. Thailand has land borders with countries including Myanmar and Cambodia. And those borders are very porous. And so while countries have stepped up, well, Thailand certainly has stepped up border enforcement, trying to stop people sneaking across, there is this problem of different people who potentially are infected with new variants coming into the country, potentially starting their own cluster, and then that cluster moving very quickly around the region. And that is why the International Red Cross has warned about surges across Asia this week. They are very concerned about a huge surge in cases across the whole of Asia, and also the fact that many countries still have very limited access to vaccinations.
My last guest joined us live from Vietnam and was talking about the strict border policies that country has in place as well. Looking across the region, what is the approach to travellers coming in, people flying in? You mentioned the land borders, but are there strict hotel quarantine systems in place? How are they dealing with travellers coming from elsewhere?
Well, obviously, it's done country by country, but if I give you some examples, so Thailand, for example, brought in a strict policy towards the beginning of last year, so maybe from March to June, where they really started restricting people coming in, and that has really stayed in place for much of the year. So if you fly to Thailand, You have to fit certain categories to be allowed to enter. They have opened it up for certain tourist categories now. But when you do arrive, you have to quarantine on arrival. There have been discussions about possibility of loosening that for people who can prove that they've had 2 jabs, but that hasn't happened yet. So there is state quarantine for foreign people coming. So, for example, I returned to Thailand from the US after the election. I had to spend 2 weeks in a hotel where you're given 3 COVID tests, where your movement is restricted. At the moment, they've actually stepped up the restrictions in those quarantine hotels, so you can't leave the room for the 14 days. So they're being very specific about their rules. Similar restrictions in many countries. Singapore, for example, restricting who can go in, quarantines there as well. But there is this problem, as I said, with the land borders, because even if you control people coming in by air, if you've got a porous land border, it's very difficult to monitor thousands and thousands of kilometres, which people can have to potentially sneak through.
Yeah, challenges facing governments right around the world. Siobhan Robbins, appreciate you joining us. Thank you so much.